Hello, my name is Myrna Basali. I am a MHS student and I had the honor of working with Dr. M this winter. And I'm doing research on the fluoride topical versus systemic supplements in children and adults. This is actually a really important topic when it comes to dentistry and in the dental world because it is used in our daily life and in all dental clinics. So, fluoride is used in community water as well, and is approved by the ADA as a safe way to prevent tooth decay. Fluoride can be and is delivered topically and systemically. Topically, it's applied directly to the tooth, and systemically, it's actually taken in supplements. So it's not directly applied to the tooth, but it then becomes a part of the tooth enamel over a long period of time. Topical is usually in our toothpaste, our mouth rinse, gels, professionally applied fluorides, such as the ones that are used after a cleaning in the dental office. Systemic fluorides, as I said, are ingested. So they come in supplements. They're dietary fluoride supplements. And they're given to young children between the ages of 0 to 6 years old. Some children have trouble building that tooth and preventing tooth decay. And so they are given these supplements to help them prevent the dental caries that happen in their tooth as young children. So it was interesting to see that there was a correlation actually between systemic supplements and dental fluorosis. And dental fluorosis happens at a later age in your adult life, and it usually is just a lot of tooth decay. So it was interesting to see that supplements that are given to prevent tooth decay of fluoride, supplements of fluoride given to prevent tooth decay, was later seen linked to dental fluorosis, which is tooth decay. It also can sometimes lead to skeletal fluorosis in worst cases if the supplement is given consistently and over a long period of time. So in the very top table, I have a chart of the age of children and the level of fluoride in their drinking water. So they have from birth to 6 months, they're not supposed to be given any supplements whatsoever. Even when they use topical fluoride, which is the one in toothpaste, it says to be given only like a smidge for 0 to 3 years. And from 3 to 6 years, you're supposed to use a pea-sized amount of toothpaste. And then at 6 years and older, it's totally fine to brush twice daily with the fluoride topical and toothpaste. But as I was saying in this table, you're not supposed to give any dietary supplements to children below 6 months. But when you start to get into 6 months to 3 years, it becomes a little bit of a gray area. You can give them 0.25 milligrams per day, but nothing above that and in a very low concentration of the fluoride. 3 to 16, it becomes a little bit more, but also still very low concentrations of fluoride. 6 to 16, it's not as bad. They can be given fluoride supplements, but it's also not recommended. It's really important to not give them these supplements during the time that they are developing their teeth, because later on, as I said, it can develop dental fluorosis or even skeletal fluorosis. Another interesting thing that I saw when it came to fluoride was how much fluoride is actually in our water. So I realized that optimal amount of fluoride is 0.7 ppm per million parts water. But the majority of our water bottles contain less than 0.3 ppm fluoride, which is less than optimal. So if you actually take a look at the second and third graphs, the histogram will indicate that a lower socioeconomic status will actually have a higher amount of fluoride in the water, and a higher socioeconomic status will have a lower amount of fluoride in the water. And that is because when you are in a higher socioeconomic status, you tend to have filters, more resources to clean your water. Some people do reverse osmosis. Some people will actually do the exception of having a higher fluoride. If somebody does the charcoal filtration, charcoal filtration will actually keep that fluoride because it's good for your teeth. So in this case, actually lower socioeconomic status gives you a hand up on preventing tooth decay. But excessive intake of fluoride at a young age during that tooth development is one of the main causes of dental fluorosis. And dental fluorosis is actually more common in a lower socioeconomic status. So although that doesn't really align with the amount of fluoride in the water, it does have over time a bad impact on the lower socioeconomic status. If the fluoride level isn't known in your drinking water, it's actually they tell you to test it, and just in case it's a little too high, because as I said, intake of it is dangerous and can cause dental and skeletal fluorosis. Many bottles of water sold on the market do not contain the optimal amount, which was 0.7 ppm. But that's okay because you can always apply topical fluoride toothpaste. And if you actually look at the bottom chart, it will have the amount that every age should be using. So under 3 years old, they tell you a smidge or a grain of rice, that's the only amount that should be applied to under 3 years old. 3 to 6 years old, they say a pea-size amount of toothpaste, and rinse it out. Don't keep it on there because it causes more sensitive gums. For 7+, a pea-sized amount or a little bit above is good for fluoride toothpaste on your teeth, because at the end of the day, it does help prevent tooth decay. Just it needs to be a balance to where it's not too much, to where it doesn't have consequences in later on in life, and that it's just the right amount to help you prevent that decay on your teeth. And that concludes my research project. I want to thank Dr. M for being such an amazing professor throughout research and really helping us realize that through our professions, we really can make a difference, whether it be small or big, and over time, just big, hopefully. But I'd also like to thank my classmates for being supportive, and we got through research. So thank you so much.